Hi, my name is Olga Luzon. I'm a clinical psychologist based here at White Hart Clinic. And I just thought I'd do a little video just to think about a couple of suggestions, ideas that people might find helpful in dealing with stress. Clearly, these are unprecedented times, really challenging and very difficult for a number of different reasons. Nothing is working as it normally does. And, I certainly notice it when people ask me, what do you do for a living? And I say, I'm a clinical psychologist. The typical response that I'm getting these days is, oh, wow, you must be really busy. And I think that's just a realization and an awareness that these are hard times for our mental health too. There are a few things that we could do. Some of those you might already be doing, some of them but you don't do. There's never enough time, but I think we need to prioritize our mental health. So some of the things is, for example, using your breathing. Breathe in for 4, let go for 8. That's a really powerful way of letting go of some of the tension. There is some muscle relaxation as well. There are lots of online videos if you look for muscular relaxation techniques that you could learn how to tension your muscle and let go of your muscle. You could use strategies to do with distraction, with describing and grounding yourself, describing what you hear, what you smell, and grounding yourself in the here and now, rather than in the worry about future things or things about the past situations. There are other things like, for example, making sure that you've got a nice lighting, access to green spaces is important. If you don't or you can't, then make sure you've got some live plants are really, really helpful. Nice smells, paying a bit more attention that you would otherwise do to all those things that are making things a little bit easier, a bit more enjoyable naturally. If you've got a little bit more time engaging in things like meditation, we know that if you do 12 minutes meditation for 2 weeks in a row, it actually makes changes in your brain, your actual neurological connections. It's quite powerful, and it's just breathing, basically letting go of some of these thoughts and being in the here and now from a non-judgmental point of view. Learning to disconnect and infuse yourself with your thoughts is a really powerful tool too. Things to do like yoga, exercise, much more powerful than any medication. If you get yourself into a routine, ensure that you can do as much as possible things that are to do with exercise in a way that is part of your day-to-day, walking up the stairs instead of taking the lifts and things like that. But then I guess thinking about lowering your expectations. These are not normal times, and sometimes we have to let go of some of our high critical demanding self and expectations and things that, if kids are watching 10 more minutes, 15, 20 more minutes of TV that they would normally do, then so be it. This is helpful for you to be able to have a break, and that's okay. So not being as critical, and review the normal routines and the normal rules that you will hold for yourself in a bit more compassionate way. And seeking support from those around you, and if you could have family around that can look after the kids for 1 full day and take a break every 2 weeks, or as a minimum, that would be fantastic. If you can get some help with someone doing the cooking, get a bit more time from a cleaner if you've got the possibilities, the financial possibilities. Not everyone does do those things, can do those things. But making sure that you, cook a bunch of things so that you could have that in the freezer and things are a little bit easier. We do need to sometimes during this period change our routines in a way that it's easier and more manageable with regards to the rest of the unexpected demands that are on us. That's just some of the key ideas, and I think the main thing that I would like to say is to differentiate between normal distress that all of us are having to manage at this point, and mental health difficulties and anxiety or depression to the point that is affecting and impacting on us or those around us, in which case seeking help through going to your GP or looking out for a psychologist, clinical psychologist, counselor. There are lots of helps around that might be worth considering, but there is help available. Okay, good. Thank you.